Welcome back, everybody. We have another wonderful guest joining us here this morning. Katie Bonner, Executive Director and VP with UnitedHealthcare, always sharing some very important and helpful information when it comes to our healthcare. And I know holidays are coming up, and you're wanting to really talk about emergency room visits and things we need to be conscientious of.
Kind of timely this time of year, because things happen.
They do, yes. Well, and sometimes you overeat, so you're in turkey coma. But yes, it's a really good time to talk about that, because when you're coming up to the holidays, a lot of times your primary care or your PCPs will close their office. So people think there's nowhere to go, and they'll rush to the ER, the emergency room, or the ED, the emergency department, and they will just have something simple like, you know, a cough or a cold, sinus infection, and what that does is it fills up, it clogs the system and slows it down, so people who need the emergent care are coming in and then going ahead of them, and the people that don't need to be there necessarily for that are waiting for hours to see. And there's other opportunities, there's other outlets that they can go to seek the appropriate care.
And that's what we want to talk about today, because sometimes maybe you just don't know what your options are, so that's why you might go to an ER, because you just want to take care of yourself. So let's talk about those options. What are they?
Well, so there's three different options, and the first would be going to your primary care physician, or PCP. A lot of people call it their PCP. Going to your primary care, and it's really important to go to your primary care, because that is the person that will know you. You will establish a relationship, and that is really just critical, because they can have that whole care experience. They will know everything about you. So if they need to refer you to a specialist, they will know which one would be appropriate based on your other needs. So your primary care should always be your entry point for something, you know, minor or acute, like sinus infections, your annual wellness visits, flu shots, things like that.
And it's pretty amazing how everything is technological now. I can literally go online and see my doctor's schedule, so I know when he's in the office, when he might be available, and I can always call a nurse if necessary. So just having that relationship, having that communication, and knowing there's ways of finding out if you are able to contact them. Yeah,
it's so important, because your PCP really is that person that can really make things more successful as you get other care around the clock from perhaps other options, but going back and making sure that that doctor knows what you've done, you know, because they know all your medications. They're really able to look at that whole picture, and that's really your go-to for first stop.
First stop. But a lot of the time stuff happens maybe outside of those hours, or they're you know, they're very busy and we can't get in. So what are some of the better options for us then? The ER visits.
Yes. So the second thing, which is something that I've used, is the urgent care or the express clinics, and they're all over town. But those are for anything, you know, maybe a little bit more severe than a minor cough or, you know, a cold or something like that. But you can go to them for stitches, you can go to them for, you know, the flu, or if you have any aches and pains. You know, the urgent care is really where I would urge people to go if their primary care office is closed or they can't get in. But again, it's similar to the emergency room in that it's first in, first out, or first come, first serve, but it's based on your needs. So if other people have a higher need ahead of you, you may have to wait in that office as well.
Because, and talk about kind of back to that relationship with your primary care provider, and a lot of people just kind of rely on the emergent, you know, where I wait until I have something wrong and then I go, and so you don't have that relationship, and that really does affect and can cost.
Yes, exactly. So 13 to 27%, so that's 1 out of 4, 25% of trips to the ER are really unnecessary and could have been prevented or gone somewhere else. So that's $4.4 billion in medical costs that could be avoided, most of which are, you know, paid for by, you know, everyone who's got some type of insurance. So it's a huge waste. And if we can help educate everyone on all the different opportunities to see a provider or healthcare professional, then maybe we can cut some of those costs.
Yeah, that's pretty amazing.
There's just talking about care from your own home and some of those. Talk about some of those options that are out there for all of us as well.
Sure, and so I personally love it. I think it applies to a lot of different people, and I think it's a great option. So there's 3 different opportunities to see a primary care or a healthcare professional for UnitedHealthcare members. So of course you'll want to see what options, you know, that are applicable to your insurance plan. But there are virtual care, there is nurse chats, nurse line, and then a doctor chat. So my favorite is the virtual care. I use this all the time. I've been using it probably for 5 years because it's wonderful if it's 24/7. You don't have to leave your house, and you're essentially FaceTiming with the doctor, or Skyping for people that don't have the FaceTime. But I love it. It takes less than 10 minutes, and I actually have called so much I know one of the physicians.
So like when you have kids, you know, and it's, yeah. I think
like for example, what would be a scenario that would make you make a call like this?
Well, perfect for kids, pink eye. Their pediatricians don't want them coming into the office.
True.
And if it's 7 o'clock at night, I'm not going to wait till the next morning because they're going to miss school. And I'm not going to the emergency room because it's not an appropriate thing to go to the emergency room for pink eye. And I'm not going to go to urgent care either. So you call.
But they need to do something.
and because they can see in Iowa face to face, they can see, they're able to prescribe medication. So pink eye, the flu, so I've had sinus infections. I've had people even call with ear infections. Things that are just kind of those minor things, but what's great is they can also triage because it is a physician. They're able to recognize, you know, if this is something that you need to go seek care at
Further
urgent care.
assistance.
But with Iowa, our winter, unfortunately, as you referenced, we will be getting worse weather soon.
Yeah.
You know, you don't have to leave your home. You can be, especially if you're sick, you don't want to drag yourself, your kids out of the house. It's cold, whatever it is. You can do it from the comfort of your home.
Wow, it's amazing the number of other options that are out there now than what there used to be.
And the nurse chat is great too. So this is something that I used when my boys were babies because you have a lot of questions. So the nurse chat is appropriate to call and ask, okay, my child has a fever of 100. Do I go into the doctor? So they're able to really help triage or direct the patient, the member. What is the appropriate thing to do? You know, do you need to call the doctor? Do you need to go to the ER? Or can you wait to get into your primary care doctor? So it's a great stop.
I like that because anymore in the world we're Googling something, and usually the reaction from Google isn't always the best answer. So let's actually talk to a person who knows what they're saying, and as you said, there's a FaceTime abilities there, so they can actually talk to you. Can see they can see how you look. You can be talking to a person and know what's going on.
Yep.
And they're pretty timely with that as well. I mean, it's not something you really have to wait to get connected with somebody either on any of those options.
No. So the nurse line is 24/7. You call in, you say hello, and it's right away. They'll connect you with someone right away. So the virtual care, you have your options of which type of doctor, if you want to see, general practice, or if you want to see, someone who's internal medicine. And it may take a minute or two for it to connect, but it's very quick. The other option, if somebody, maybe they have laryngitis, is to simply, chat online with a smart device online with the doctor.
Wow.
And again, they can help understand if this is something that is acute, or no, you need to put your phone down, and you need to go to urgent care or to the emergency room.
Pretty amazing options out there, and just want to make you aware of what those options are. When you hear again annually 13 to 27% are going to the emergency room unnecessarily, which is costing $4.4 billion in medical care costs. We can make a little bit of a difference in there and not be so wasteful, but also utilize each other's time, even our own, in a more proper way by utilizing these other options. That's pretty huge. If people want more details, because you've intrigued my interest about some of these, I'm like, wait a minute, I don't have to leave my house? This is amazing.
Download the app.
How can we learn more how to do all of these?
So this is, I think, the easiest website I've been able to say since I've been here. So it's uhc.com / know where to go for care.
Okay, that makes
easy to remember.
Know where to go for care.
I love that.
It's a really great feature of the tool. So you can actually read kind of a checklist and see, okay, I have this, and it will direct you where to go.
Where to go.
And then it will also give you a checklist of items that you should bring with you to your PCP or your doctor and ask maybe some questions to prepare you for that visit.
Love
so
it.
it's really
Making
effective.
us all do a better job with getting where we need to be and,
Yes.
and what we need to have with us.
Know where to go for care, all courtesy of UnitedHealthcare. You do incredible work as we're heading towards the holidays, family, friends, all gathering around.
Busy time.
Let's make sure we have all that information on our devices so we can do the best thing possible. Thank you so much
You're welcome.
for joining
Thank
us.
you.
Great information
Thanks.
today.